When you think of drug overdoses, you may think of cocaine or maybe heroin.
But not in Utah. Here, the #1 overdose killer is the painkiller methadone. Dan Rascone joins us tonight. And Dan, this is not just a problem here in Utah.
No, it's not, Mark and Michelle. A big problem outside of Utah. Of course, just last week, USA Today had a front page article right here on how methadone tops other prescription drugs for deadly abuse. And methadone is now making national headlines in the death of Anna Nicole Smith and her son, where the drug is being investigated as a possible cause of death. That leads to the question, why is it killing so many people, especially in Utah?
This is not right. It's not right. He should be here.
Karen Lasrich still can't believe what happened to her 41-year-old brother, Mike Kennedy, a husband and father who suddenly dies from taking this painkiller prescribed by a doctor, methadone.
You know, I know it's supposed to be a wonderful medication, but it can kill you. That is the bottom line of this medication.
One day he came home after his treatment, laid down, and never woke up.
And this woman who doesn't want to be identified says methadone also killed her son. It too was prescribed by a doctor.
Gosh, we trusted him, you know, and his actions led to our son's death.
The percentage of overdose deaths in this state is an astounding number.
And that is why Dr. Lynn Webster, director of the Lifetree Clinical Research and Pain Clinic, is heading up a campaign on methadone.
What I'm trying to do is educate physicians about the unique difference with methadone from all of the other opioids, how it's metabolized, how it's distributed, how it affects bodies, and how we need to prescribe it.
According to the Utah Health Department, methadone is the #1 drug overdose killer in Utah, beating out cocaine and heroin. Back in 1997, there were 7 deaths related to methadone. In 2005, that number has jumped to 113 deaths. That's almost 1 person every 3 days. And according to a study done in 2004, half of the methadone deaths came from people who were using the narcotic legally, prescribed by their own doctor. And that's why Dr. Webster says doctors need to understand the risks, and so do patients.
Some patients, some physicians, want to help you with your pain, you want to help yourself with the pain, and so you have a tendency to take a little extra to get on top of the pain. But you cannot make that assumption. If you do, as a physician who's prescribing it, or as a patient who's consuming it, it could be lethal.
Okay, you get 100 today.
Methadone is basically used for 2 purposes, as a painkiller
There you go.
and as a narcotic to treat heroin addicts, like Tina, who started taking heroin at 14 years old.
I was really bad. Yeah.
But now Tina says she's been clean of heroin for 11 years, thanks to methadone.
So I think methadone's a lifesaver, personally. Yeah, it's helped me get my life together.
Done safely, it's absolutely one of the safest medications around.
Jerry Cosley heads up the Metamorphosis Clinic in Salt Lake, where every day dozens of people once hooked on heroin come through the doors to take methadone. But Cosley says he also realizes the dangers of the drug.
As a street drug, it's in my opinion, one of the most dangerous of all street drugs.
But that's why Cosley says they take very serious steps in prescribing the drug. But as doctors are now realizing, you don't have to buy methadone on the streets to never wake up again.
These doctors, pharmacies, the patients taking it, they need to know that exactly what they're getting themselves into.
Now, the Utah Health Department is so concerned about the rise in methadone deaths that it is now conducting a study to try and figure out why so many people are dying from it and what could be done to better educate doctors and patients. That study is expected to be done within the next few months.
So interesting. I had no idea.
Yeah, it is. It's pretty amazing how many deaths are taking place.
Any chance that they might ban the drug because of all these deaths?
From what we're being told, no, there's no chance right now. But what they're being told also is that the FDA did issue a warning for methadone use last fall and is looking into the possibility changing the way it is prescribed. But from what doctors in the health department are telling me, methadone has different effects on everyone, especially when patients are taking other medications. And that's why it's so difficult right now to kind of pinpoint these deaths, because every death is a little different.
Yeah. All right, Dan, thanks.